slud, not slut, but slud over here. So got S-L-U-D-D-D sort of thing. So salivation sounds like what? Your mouth gets real watery when you smell food, that sort of thing, right? So it's preparing the body to eat food and digest the food and all that. So that's a good one. So salivation over there. What about lacrimation? What's that one? Yeah, tearing, that sort of thing, right, on this one. You get a little bit of urination, so that's a parasympathetic response. D, we can put some digestion in there. And they have defecation and decreased heart rate, all those good ones. Pupils will constrict, right? And also the airway passageways are smaller, right? Less respiration, that sort of thing. So basically everything gets shut down in this end. So you guys are good for those? Those are pretty easy, right? So everything's on the downside. Cool, those are good. We're good there. And here are those ganglia things we talked about from the other day. We mentioned how it was a spot, an area where those two neurons can communicate with each other. So we'll have some of those for you to see here. And those are called the autonomic ganglia, and they come in different varieties. Again, you include the sympathetic ganglia and the parasympathetic ganglia. So you have to remember, this is my little piece here, right? And here I have my cranial nerves, 3, 7, 9, 10 sort of thing. So 3, 7, 9, 10. And then S2, 3, and 4. S2, 3, and 4. And so they have two neurons in that pathway. So there has to be some ganglios over here too. We didn't talk about those yesterday because they are different. So I have some over here. We talked about these ones here that are with like T1 down to like L2. All of these sympathetic chain ganglia. My little prevertebral ganglia. So we just looked at those, are the only ones that we're going to take a look at. But these other ones do exist as well. So I do have some for the sympathetic and parasympathetic both. So they're both classified as autonomic ganglia though. Okay, so we're good there. So we'll go a couple more slides here and figure out what's what here. Let's see. Here's my sympathetic ganglia. So again, those are, which one's sympathetic chain ganglia? That's the one that looks like a chain. That would be good to know. So we call these guys here my sympathetic, I'm going to abbreviate that, chain ganglia. It has another name too, which we call it. These ganglia include the sympathetic chain, also known as the paravertebral. So it runs parallel to or right alongside of, and so those are also called my paravertebral ganglia over there. And then what else do I have? I have prevertebral ganglia. So those are these little guys over here.
The celiac, the superior and the inferior.
Exactly. So my little prevertebral ganglia, of which, yes, we have the celiac, the superior mesenteric, the inferior mesenteric. And those are also called like the collateral ganglia because they're like off to the side a little bit. So you might see those either way. But as long as you know that, those three are looking pretty good. You guys okay so far? That we did it yesterday. We'll go through the whole thing one more time for you too. So celiac, superior mesenteric, inferior mesenteric. So again, they sit over by that abdominal aorta and all that good stuff. Okay. Now here's my parasympathetic ones, which we're not going to do. Okay, I just sort of focus on the sympathetic ones. But these include things like the ciliary, the pterygopalatine, submandibular, tonic, all those good ones. So those would be the ones like here, as I mentioned before, like these guys here, that we're not going to cover those, but they do exist, right? Okay. All right, so those are okay. So just sort of skip that slide, if you will, as far as naming those. Here it sort of compares sympathetic to the parasympathetic. And so they've actually named these a couple different ways too. If I have this section with my cranial nerves and my sacral nerves, they said, well, let's just go ahead and call it the cranial sacral division. And that's where that name comes from right over here. So the parasympathetic is also known as the cranial sacral division. What should we call the ones here for my thoracic and lumbar area? Put the two words together. So I have thoracic and lumbar called thoracolumbar. And so your sympathetic is also known as the thoracolumbar. So again, like a little confusing again? You guys are doing okay? All right, anyway, so this is my tube. So my sympathetic chain, my sympathetic area is thoracolumbar, so T1 through L2. My parasympathetic is the cranial sacral division, the nose. What else is sort of like unique? I know preganglionic cell bodies in the first two lumbar. So again, T1 through L2. Over here I have, the nuclei for cranial nerves, so 3, 7, 9, 10. And sacral spinal cord, we're good there. Some other ganglia. So I'll go through and like sort of pick and choose like what's good to know. So we're almost done. Just hang in here. We're getting close. We'll draw that picture again, some other crazy stuff. We're going to skip all this autonomic plexus stuff. And if you remember, like a plexus was like a blending of nerves, like from one, from like here and from here, and they all sort of blend together. So we do have some more of these plexus that are out there. And so they show you the cardiac plexus and the celiac plexus and all those good ones. But I can't remember sort of like ixnay of that stuff. Just try to keep it really basic for you. Let's see, innervated by each spinal nerve. Okay, so skipping that, we're skipping that, and skipping that, and skipping that one too. And here's a good picture though. That's pretty much what I was trying to show you yesterday, drawing the picture out for you as far as if I'm going to like a heart or your liver or your gallbladder or whatever. And then I showed you one here too for like the adrenal glands and some other things like that. So we're gonna like map that whole thing out like one more time for you. But we talked about like preganglionic and postganglionic neurons and all that. So we're going nice and slow to make sure everybody sort of gets it. If you want to have, take a look at it over the weekend and try to like make better sense out of it too. So we'll come back to that one too. We're skipping this as well. This is some other stuff with like the sympathetic division, like what can happen. We talked about ptosis of the eye, pupillary dilation, don't care. We already did this, so 3, 7, 9, and 10. We're okay there. S2, S3, S4, we're okay there. We already did this, right? Oculomotor, facial, those are my cranial nerves. We're okay on that one. Yeah, don't care about any of that stuff. Don't care, don't care, don't care, don't care, don't care. Already did it. We're good. Don't care, don't care, don't care, don't care, don't care. Maybe care. I don't know. Let's see. Hold on. So, don't care. Okay, yeah. And don't care again. Already sort of did it, but we'll do it again. On the board. We're good. Don't care. Don't care. Don't care. Don't care. Don't care. Hey, that's it. Okay. All right. So let's go and like draw some pictures. What do you guys think? Okay, that's good. So, all right. So we'll run through and I'll show you exactly what you have to know. And then we'll draw some pictures, and then we'll still be good, right? It's only like 2:20, so we're good, yeah. Okay. All right, let's turn this thing off over here, that way. And then, it's slowing from like yesterday. It's crazy. All right, so I'll run through and I'll tell you exactly what you have to know. Little by little, we'll go through the whole process and do that. So whatever I write down is like good to know, I would say. Trying to make better sense.